that cataract surgery could reduce the risk of developing dementia. Other adults who had the procedure to improve their vision have had a lower risk of Alzheimer's and some other forms of dementia as well. Here with us tonight to talk more about it is Dr. Geoffrey Emerick, an ophthalmologist at Hartford Hospital Eye Surgery Center. Doctor, thank you very much for being here tonight.
Thank you.
Well, this sounds very exciting, but can we start with you explaining exactly what a cataract is, what it is?
Sure. So cataracts are a clouding in the lens of the eye. It's kind of like looking through a dirty windshield. It causes blurred vision and glare, especially with night driving. So they usually develop gradually, but eventually cause problems with daily activities. And actually, cataracts are the leading cause of blindness worldwide, but fortunately are very correctable with surgery.
Well, that's certainly good news to hear, but at what age do cataracts usually appear in folks?
Right, so they can start after age 65, but by age 75, about half of people have cataracts that are cloudy enough that could benefit from surgery. So some people will develop them a little bit earlier with certain risk factors and others later, but that's about the age.
And you just mentioned this, but this can be taken care of with a pretty routine surgery now, right?
Right, exactly. So fortunately, here in the U.S., we have good very high-tech surgery, and it's a quick, easy recovery, and people are really able to improve their vision. So it's great to be able to offer that.
Yeah, that's certainly great news. And now this research is showing that that surgery can reduce the risk for Alzheimer's disease and other forms of dementia. That seems remarkable.
Right. So it actually isn't the first study to show it, but it really gives the best, strongest evidence that we have. So a group with lead author Cecilia Lee from the University of Washington followed over 5,000 people for several decades, and they found that people who had cataract surgery were 30% less likely to develop dementia. So it's really exciting because no other intervention has really shown such a strong association.
Well, obviously they are studying all this right now, but any idea how undergoing the surgery impacts brain health?
Right. So the eye is connected to the brain. If there's less visual information going to the brain because a cataract is preventing it, that could speed up aging changes. And so if you restore vision with surgery, not only does that improve quality of life, it helps to maintain overall brain function, including language and memory skills and everything else. So it's not just vision, seeing better, and quality of life. It could affect things and brain health down the road.
Well, it really is remarkable, and obviously it shows the incredible progress that researchers are making and doctors like yourself. Dr. Geoffrey Emerick, thank you very much for joining us. We appreciate your time.
Thank you.
For more information, you can go to hartfordhospital.org/eyes.